Hi, dear listeners, and welcome back to Blush and Bloom, the podcast where we talk about women's health, self care, and everything in between. I'm your host, Gigi, founder of Asale, your space for cycle aware and preventive care. I'm really glad you're here with me on this journey to unpack women's health and highlight the incredible things being built in this space. So let's get into today's episode. All right. Hi, Dr. Helena. Thank you so much for joining me on the Blush and Bloom podcast. So, for people who are meeting you for the very first time, how do you introduce yourself and the work that you do?
Well, first, thank you for having me on. I'm Dr. Helena Fowler, DCN. I'm a doctor of clinical nutrition, and I specialize in stress, specifically in high performing, high achieving women who work in an environment of chronic stress or a high stress environment. And for me, I define stress as the intersections of gut health, hormonal health, and sleep. I'm also a
Okay.
startup advisor for women founders. I can't forget that. Second half of my
Absolutely.
life. Yeah.
Awesome. So when you say startup advisor, care startups or in like
Oh,
general?
yes. So femtech,
Mhm.
health and wellness, climate sustainability, and of course, food and nutrition. And we serve primarily women founders or women founded teams or women leaders, not exclusively, but primarily. Trying to think if there's, and we tend to operate at doing fractional or interim C suite support within marketing strategy, product strategy, and sales ops, but we could be general advisors too, just depending on what the founder needs.
One,
Sure.
you wear multiple hats. You're a clinician, you do marketing, you're an advisor, you're a podcast co-host. Is there something that brings all these things together for you? Like, how did you end up being so diverse in your skill sets?
So I would say that I have 20 to 25 years of experience in marketing strategy, product strategy within the tech space, but I've also had a private practice in with nutrition, Ayurveda, yoga, guided meditation for 9 years. It turned nine. It was intentionally small for a long time. And what I do now, what I realized was that it wasn't an either or path for me. And I think as women, we often feel like it has to be all in on one thing. But I really discovered early on that it's a both and. And so I don't do either one. I'm not an advisor or an interim C suite full time, and I'm not a clinician full time. I do both, and they inform both sides inform my practice. So I take all of my nutrition knowledge, all of my biochem, nutritional biochem knowledge, and I apply all of that to the founders and the businesses, the startups that we work with. And I take a lot of what I've learned in leadership and connecting dots and just pattern recognition and different ways to solve problems very uniquely. I apply that to all of the private practice clients I see. So where I am now is sort of the culmination of all of my passions and all of my skill sets.
Awesome. Thank you so much for sharing that.
Mhm.
And so, what sparked your interest specifically for nutrition and women's health?
I've always had a fascination with why things work the way they do and how things work the way they do. But similar to many practitioners who enter nutrition, it came from my own personal health. I had some health things that happened. No secret, I have a hypothyroid concern and it was stable for a really long time. It became unstable and I kind of had to rethink everything about what I ate, what I did. And that combination of having to understand all of that for myself and realizing there wasn't a whole lot of information out there and wanting to understand how and why things work the way they do led me to a certification program at the University of Washington many, many, many years ago. And that was sort of the gateway. The more I learned, the more I wanted to learn. And then I wrapped a doctorate of clinical nutrition. And I actually did not expect to find myself going back to school ever, let alone again soon. But I am now in another program to be a therapist because what I found is that we, especially women, have often, when I work with people with chronic stress, women with chronic stress, and that often comes with depression, anxiety, PTSD, trauma, things that I can't support them as a nutrition clinician and I'd like to be able to support more on. So I find myself there. But women's health, it kind of came to me. A lot of the clients that naturally gravitated toward me in dealing with chronic stress tend to be women. And then when my business partner Sarah and I on the startup advisor side started really looking at a lot of the businesses and startups that we wanted to support and the founders we wanted to support, and we looked at the resources out there to support them, we were just dumbfounded at the disparity in the amount of funding that women founders get and the amount of support in time, resources, and finances. And we thought, that's where we want to be. We want to be helping to support founders who are bringing forth the services that and the products and the solutions that we ourselves will be using as we get older.
You specialize in the intersections of, as you mentioned earlier, stress, gut health, hormonal health, inflammation, sleep. Why do you
Yeah.
think these areas there are more issues why are women mostly affected by these issues?
Sure. So our hormonal changes are very different from men's hormonal changes, right? Our hormonal changes can impact every area of our life. And then our gut health it's very interconnected and woven into all of these pieces. And sleep is one piece where whether you are a mom or not, you may be in a caregiver role or not, but there's a good chance that as a woman, you may have a bigger area of responsibility within the workplace and at home for caregiving. And
Mhm.
so we are usually the ones that are impacted by decreased sleep. And we also have the hormonal fluctuations throughout the month and throughout our lives that impact all of these things. And so stress it just impacts us more and in different ways. We have higher rates of burnout, whether that's in the professional arenas or other areas of life. And so it's all of those things tend to just impact us in a deeper way.
Okay. Thank you for sharing that. So, what are some of the common patterns you see when women come to you struggling with stress related health issues?
So the thing I hear the most is that a woman feels tired and wired. So
Mhm.
maybe they're mentally or physically exhausted, but they're so running on this fight or flight sort of state that they are just wired. They can't sleep, they're fatigued, but they are on. There's just yeah, that's one of the most common ones. Afternoon fatigue, especially in the 2 to 3 p.m. time frame. That's very common. Excuse me. I also see things like just not being able to disconnect, not being able to prioritize our health or our needs. I see a lot of just drained in energy, feeling disconnected. And I would say often I see women underfeeding themselves.
Interesting.
Yeah, very often. I mean, that's who I see.
So, if there is one myth about nutrition and women's health that you could erase forever, what would that be?
Gosh, there's like 5 things off the top of my head that I could think of, and I think the top one that kinda does battle in my mind with there's no one way right to eat. I think a lot of times people think that if I could just find that one perfect way, that one perfect dietary pattern, like that's gonna be what's best for me, or most often, a lot of women just feel that they need to lose weight, which is partially why there's underfeeding.
Mm.
But sometimes even when weight's not a part of their concern. There's just underfeeding for lots of other reasons, but there's often this fascination or this thought of, I have to eat a certain way. And there is no one right way. Right. And then I think the other one that it does battle with are macros or everything. We have so much focus on our macros, on our proteins, our carbohydrates, and our fats, whether carbs are bad or they're not bad, or fat is bad or they're not bad, or different types of fat, different types of carbs, different ratios. But
Yeah.
what we forget about are the micronutrients. Carbs are in everything. And I'm not saying they're not important. They are important. Not carbs. Macros are in everything and they are super important. But what's almost more important are the micronutrients that you're getting because your vitamins and your minerals, which are the micronutrients, your body doesn't produce a lot of them on their own. So if you're not eating them,
Mhm.
you're not getting them. And if you're not getting them, you don't have the basics of what you need for the building blocks to support mental health, to support a lot of the things that are going on in your body. So I think the over focus on macros probably competes with the thought that there's one right way to eat.
I think this conversation that we're having is in like very sensitive territory because I was super excited to like you said when you said yes, because I've always wanted to chat to a nutritionist because right now it's like the Ozempic era and everybody's
Mm,
there is so much talk about weight loss and nutrition and how you're supposed to eat like this and not like this. And it's
mm.
so strange having all these conflicting ideas on what is the right way to do things and what isn't the right way to do things. And then there's so much advice coming from different places. So I guess my question would be like, I don't think everybody can afford a nutritionist, but they
Mhm.
do want to eat healthy. So how can the average person filter out what is actually good information? Because there's so much of it on the internet, and how can they have like this sense of understanding like, okay, this is something that sounds right and this is not right.
That's a really great question. I think there are some sites that and sources that give out really good information. And I wish I had my go-to resources right here to be able to verbally like tell you the best ones of what I think those are. But I think what I'd rather do is pull together a really good list and then send it to you to
Okay,
include
awesome.
maybe in show notes later, because there is a lot of misinformation out there. And there's, I think, a lot of opportunists who see vulnerable populations, women who, not all women are vulnerable populations, but there may be women who are looking very, very hard to solve a problem. And they may come across some people who are very willing to give them solutions that have no evidence behind them, that are just, that sound too good to be true and usually are. And yeah, it's hard to figure out who to trust. I would say take a look at their credentials first and foremost. Where I live in the state of California, for instance, there's not a lot of regulation around who can call themselves a nutritionist. I could literally set up an Instagram account for my dog Cleo and call her Cleo the nutritionist, and nobody is going to. I'm serious, I could. And no one would, there's nobody that would say that that's wrong or illegal or misleading or anything like that. So look at the person's certifications and what they stand to benefit from. Are they trying to sell you something? Are they trying to get you to buy something? What is their motivation? And then you try to go to trusted peer reviewed resources. And I know this sounds really dry to send somebody who, to send any average person to go look for research. That sounds really boring, but often there's some really good, I'll say, aggregated reports, what
Mhm.
we would call a systematic or review or meta-analyses, aggregated reports that you can find very easily, open access, that answer a lot of questions that you might have around nutrition, whether you're looking for a dietary pattern that supports autoimmune or brain health or cognition and those types of things. There's been a wealth of research that there's probably a systematic review or aggregated report that may have some of that information. And that at least gives you a more evidence based place to start from. But I'll send you a list of resources that are a little bit more go to for anybody that just might be looking.
Okay, thank you so much. And another question I have is so it's basically either going to change the way I run my startup or maybe feel like I'm going in the right direction or it needs more time to cook. So there's this thing around adjusting your diet, although it's not like a one size fits all, of course, but like adjusting your diet to where you are in your cycle or adjusting your diet if you're going through menopause and it can help you like with men what's sorry, I can't find the word right now, it's on the top of my
Yeah.
head. Like managing symptoms.
Yeah.
Is this what are your thoughts on this? Is this actually something that's reasonable or is it pseudoscience?
No, I think that is reasonable. Our bodies do have a preference for, say, the way that it metabolizes or has a preference for carbohydrates in part of our cycle versus a preference and prioritization for fats during a part of our cycle. So I do think there is some merit in saying, I'm going to focus more on not necessarily adding fats, but decreasing carbohydrates, say, like in the second phase, or versus preferencing or having a preference for carbohydrates. I think that becomes more important for women who are highly active, not necessarily that are athletes, but that are extremely active, because you need to make sure that you're properly fueling your body. When we start to go through perimenopause and menopause, there absolutely is a place for considering the interactions of the food that you're having along with your hormones. I would say, especially foods that have phytoestrogens that are in them, can do a lot to help regulate some of the cycle related concerns that somebody might have, even regulating a cycle. If there's somebody who's in perimenopause, maybe haven't had a cycle in several months, and if they want to try something called seed cycling, which this is one of those areas, there isn't a whole lot of research around seed cycling, but the premise of seed cycling is that you're choosing different seeds and foods that are really high in certain phytoestrogens, and it can help to regulate a cycle and even create a consistent cycle. Granted, it will be based on only during the time, that you're taking that. But for some folks who maybe are on the cusp, it can help regulate it out. And for others who are already in menopause that don't have a cycle, it can actually really help to even out sort of some of those symptoms from the estrogens that come from these nuts and seeds. And it also usually involves taking additional omegas and primrose oil and some other things. There's more to it than just nuts and seeds. Yeah.
Interesting. And what are
Mhm.
the because yesterday I literally had a conversation with the founder of Roller Coaster. Her name is Garima, and she's building she okay no she's making this like sort of nutrition bars for women based on their cycle. And she mentioned seed cycling yesterday, and that was the first time I heard about it ever. And you mentioned it again, so
Yeah.
interesting.
Yeah, I mean, honestly, the first time I heard about seed cycling was when I was going through some of my Ayurveda studies, and I looked at it skeptically, if I'm being honest. I was
Yeah.
like, "Really?" But it was when I went through my nutritional biochem, I started to understand how these things layer on, and then I also had one of my professors in my doctorate program, our hormone professor, she was talking about what she uses as, for folks or ladies who maybe don't want to try HRT right away, like alternatives and things to more naturally support hormonal balance. And she mentioned seed cycling. And I thought, so there might be something to this. And then on a very personal note, I myself am at an age where I have to think about perimenopause and things. And I've tried it. I'm an N of one. Take that for what you will. It's not for everybody. But I will say that for anybody that chooses to do seed cycling, when they do have these seeds, it's not like seeds that you just sprinkle on in your soup or on a salad. Like, right, you're not integrating it as food. You're treating these as you would a supplement or something more intentional like that.
So let's talk a bit about your podcast. So could you share about what your podcast is, what it's about, and what's your favorite thing about it?
So my podcast is called A Coach, a Nutritionist, and an Expert Walk Into a Podcast. And my co-host is a mental performance coach. His name is Mike Kraus. I give the nutrition perspective, and we usually have an expert who may be with us for one episode or more. Last year, we actually would have them on for an entire month. So for 4 or 5 episodes. This year, it's sort of, we've just been playing with the format. And it's an opportunity for us to tackle a topic from three perspectives. And we don't always stick within our lanes. You know, we like to keep it very informal, just like a coffee chat. And we encourage just open dialogue. Mike and I started it because we just love learning. We love learning from the people that we have on and just soaking up all of the knowledge that we get from them. And we end up laughing a lot. And so I think my favorite thing about it has been the range of topics and the range of experts that we've talked to. We've talked to a lot of folks, and we could have record a podcast on the same topic with the same expert and have a vastly different episode each and every time. And I love that.
Okay, thank you so much for sharing that. So you also advise startups. So has there been a startup that you've advised that stood out to you and you love to talk about? And what was your favorite part about advising them?
Oh my goodness. Okay. So I currently serve as a Springboard advisor. Springboard's a nonprofit that pairs advisors and or a group, a team of advisors. You could get like 8 advisors with a cohort of startup founders, women founders who also go through their sort of accelerator boot camp. And I've had the opportunity to listen to, can't even articulate the number of pitches that I've listened to and the number of folks who I've been able to serve in some capacity or another. But I will say that I think two of my favorite companies that do vastly different things that I've been able to advise, at least through Springboard so far, have been a company called Nalu Bio, who uses small language models and AI to create new molecules that use the endogenous cannabinoid system, or ECS, which a lot of people don't know about. These are not like psychoactive THC type things at all. We have an internal cannabinoid system, and it's molecules that work to address concerns that women have, like endometriosis and pain and and things that come from that. And the work that they're doing is remarkable. It's unique. It solves a meaningful problem that has been incredibly challenging to solve for women. And I just think I see so much potential in what they're doing. The second piece, or the second one, is Welltory. They are an app who started in the HRV space, the heart rate variability space, and they have found a way. So, as a clinician, one of the trickiest pieces in talking to clients is adherence. It's getting clients to just stay motivated and remember why they're doing the things that they do, the actions they take to sustain these actions long term to lead to behavior change. Because at the root of all of this is behavior change, right? Welltory has figured out a way to really drive sustained behavior change through a very gamified app. It's pretty incredible what they've been able to do and how they've been able to draw the connections across your health, and connecting that to, say, if you are yourself a founder, the performance of your business. Like if one of your stressors is fundraising or revenue, then you can actually connect some of these other apps. I think you can connect even like GitHub and Stripe and all of these and see what performance for these work related things are having on your actual stress levels. It's pretty incredible because I think there's a lot of opportunity there too for them to be able to address some pretty meaningful problems and concerns.
Okay. Thank you so much
Yeah,
for sharing.
you're
Okay.
welcome.
So there's this, I don't know if I should call it the chia seed epidemic because everybody's suddenly obsessed with chia seeds. And there's this doctor I saw, and he doesn't exaggerate the chia seed thing, but he did mention that it's good for gut health. So, what are your thoughts on this? And is there any other way people can hit their fiber goals beyond a lot of chia seeds?
Yes. So I think part of this phenomenon has to do with quote fiber maxing, where people have been encouraged to have incredibly large amounts of fiber, like 100 grams of fiber. I would not personally recommend that. Most people's guts can't really handle that, especially right away. And depending on if you have things like a hypothyroid or where you are in your cycle, that could really throw some things off. Chia seeds have some really good omegas and fiber, yes, but you either need to have them soaked or ground
Mhm.
because often, if you're just eating them, like if you're just sprinkling them on something and you're eating them, if you don't chew them well, then you're not releasing any of those properties and they will basically pass right through your body. Yeah. And if they're not soaked well so that they're nice and soft, you won't again be releasing any of those. Whether it's, I mean, and I guess you could say that it could potentially act like some insoluble fibers, but really it's just not going to do much for your body if you're not well chewing them. Same thing with flax seeds. There are other ways that you could go about getting more fiber. And I think variety is always really good. So if you're relying 100% on or close, the majority of your fiber from one source, the body likes variety. And
Mhm.
variety is what's best for your gut because you've got trillions of bacteria that are in there and they all like different things, and they all respond to different things. So simply having a bunch of chia seeds may serve one population, but it might not serve the rest of them. Your gut's a very diverse place.
Okay. Thank you
Yeah,
so much for sharing that. I knew about the soaking part, but I didn't know about the chewing specifically.
yeah. It's if you don't chew them well, you can actually use chia seeds. Okay, this is not meant to be kind of gross, but you can use chia seeds as a motility test. If you're interested to see how powerful your digestion is, you could swallow some chia seeds or just not chew them well. And same with white sesame seeds, and then see how fast it is until you see them again.
Oop, got it.
The amount of time and the level of wholeness can tell you how strong or powerful your digestion may be, if you're digesting too fast, if you're digesting too slow, if it's just right. Yeah.
Okay, thank you. So we were talking about like nutrition for African women and how some women aren't aware that they need to eat certain foods like for iron, for example, or they need like a vitamin like B12 or something for to help with their blood because of the cycle period every month and all that stuff. When we were having that discussion, it reminded me of how I felt like I was eating everything that I should have been eating to be able to support with my period and everything, but it seemed like it wasn't working and I needed supplement. I felt I needed supplements. I had to go to do a test and it was indeed low. So
Yeah.
I came across the same guy who talked about the chia seeds. I think his name is Dr. Karan. He has this weird obsession with poop. I saw random stuff that helps with gut digestion. Anyway, so he talked about eating foods that can give you iron, like red meat and all that stuff, and then vitamin C helps with the
Synthesis. Sure.
synthesis, yes. So
Mhm.
and he also did like this whole series of how if you eat this and this, it will help with this, how this and this food helps the synthesis of that. So I wanted to get your thoughts on this. Like, what should women know? Because I don't think this is common knowledge because I also learned it myself, even though like I studied biochemistry, so I thought I should know, but I didn't. But I did understand like the science, but then I didn't know that this was a thing. So what do you think that should be general knowledge but isn't in terms of diet that can I think can apply to a good number of women, like this one, that
Hmm.
eating this supporting that.
Okay, let's see. Um, well, I mean, iron, anybody that still menstruates will probably have a higher need for iron, especially in the week when they're in that, the week before their cycle starts, when you might be experiencing some PMS symptoms. And then as they're actually active bleeding in the first few days of that follicular phase, some iron. Additional iron. If you are a meat eater, of course, having some meat is going to help with that. If you're not a meat eater, or if you are already a place where your iron levels might be low and your iron levels you'll start to feel symptoms before they really show as being clinically low in
Mhm.
lab work. So a lot of that could be fatigue. That's probably one of the most common ones. And so I guess always check with your provider before you take a supplement. But if you're going to take an iron supplement, the half-life of iron, like you really actually, it's most effective taken in the morning every other day. It has a circadian rhythm to it. Iron does. And so it actually has better absorption when you take it in the morning and you take it every other day. You look intrigued? I can send you the paper on that if you want. It's pretty fast. Yeah, there's a lot of things that have circadian rhythms and that impacts how we absorb things. And I would say that having the right types of fats very important. Omega-3 fatty acids, having a preference for those are important for us in many different ways, but especially when you're in that second half of your luteal phase, because it's going to help with some of the inflammation that's going on in there. I would say refraining, I know this is going to, people are not going to love this, but refraining from alcohol, even wine, when you're in that second half of your luteal phase. Actually, even if you're perimenopausal, but especially at night. And the reason for that is because alcohol will interfere with your sleep. It might help for the first 3 or 4 hours, but then it's just going to interfere with your sleep. It provokes inflammation in the body. And when your body is already reacting to focusing on your cycle, that's really difficult for your body to also to work on. Alcohol serves no actual beneficial purpose within the body. So the body prioritizes it to get it out, which means it's a lot of your other processes will take a back seat to alcohol being out. But for perimenopausal women, it's often a hot flash trigger, alcohol consumption. So I would say limiting the alcohol, especially at night, is probably one that a lot of people, a lot of women don't know about, but can be eminently beneficial. And then let's see, for protein, I'm not one of those practitioners who thinks you need to have like 200 grams of protein. I do think we don't have enough protein, and you should be getting probably around 1 gram per kilogram of body weight per day. And that goes up as we age. The types, I would say, just make sure that we're getting complete proteins. And what I mean by that is that your essential and your non essential amino acids. We tend to just think of protein as meats, but we don't pay attention to the amino acids. And the essential amino acids are ones that our body doesn't make. So you only get them from food. And so, like the doctor you're talking about, thinking about some combinations of foods like beans or rice, chickpeas, and pita bread, like these types of things tend to have both types of, or all types of the amino acids in them to create a complete protein. You can also just look for the words complete protein on some of the foods or supplements that you're taking. And then there was one more. Yes, don't be afraid of exercising on your cycle. You just need to adjust maybe how hard you're going to not overstress your body, but it's perfectly fine and encouraged because exercise in general can provide positive stress to a point to the body. It's called hormesis, positive stress, but you don't want to overdo it when you're on your cycle, but it's perfectly fine. And as women, especially if you're at a perimenopausal age, we should be doing things like HIIT and sit and strength training with heavier weights to build that bone so that we can avoid future osteoporosis and
Mhm.
build the muscle to avoid sarcopenia as we age. We lose the benefits of estrogen, which is catabolic. So the HIIT and the sit and heavy weights
Mhm.
basically force the body to have the reaction that estrogen is no longer providing.
And how about hits? I've never heard of sit.
Sprint interval training, high intensity interval training, and sprint interval training. So, sprint interval training would be like you go all out as hard as you can for 30 seconds. And
Mhm.
then you take an active recovery for like 2 minutes. And then you could do like 5 rounds of that or something. And that would be all that you would need for that. Yeah.
Interesting. I've only done, and I recently learned about the strength training part. And thank you for including that because I don't think it's that much of common knowledge that women need to do strength training because the idea is that some women don't want to look bulky, so they avoid strength training and do only cardio or something like that.
Yeah. Well, and the thing is like addressing that, it takes a lot of weight and constantly adding weight very thoughtfully over time to bulk up. You can
Mhm.
very easily do strength training or body weight training, adding on weights at good amounts of weights without actually over bulking the muscles.
Mhm.
But it is definitely needed. And we should be thinking about that at younger ages because usually at the point that perimenopause is hitting, if you haven't actively been working on that, your body has already started sort of its
Mhm.
adjustment to not utilizing your bone building processes and muscle building processes as well.
Okay. Thank you so much for sharing that. And then
Mhm.
you mentioned the part about alcohol. I think it reminded me of it. I'm not sure how valid this information is, but I think I just like randomly saw the video. I can't remember where I got this from, but it was basically saying that it's how it's like the glass of wine, women having a glass of wine at night to relax is a marketing gimmick that it's similar to the how the companies that make cigarettes were able to convince people that it's some kind of thing to help you relax or bond with people, and they were able to influence women by making it look like it's this kind of calming, relaxing activity to have a glass of red wine to relax after a hectic day, something like that. So when you brought it up, it just reminded me of that video I saw.
Oh, I think what you bring up is actually a really it's a demonstration of how science has come along and evolved. Like it's one of those the more you know, the more we test, the more we know. And so for a long time there was a belief that red wine was beneficial,
Mhm.
cardio beneficial or heart beneficial. Really, it's the resveratrol that's in it. And to be beneficial, you would have to have so much red wine. Like you couldn't drink enough red wine for it to be beneficial. You would be just killing your liver and your kidneys at that point. Like it's just not going to work. And then there was the thought that, oh, moderate alcohol consumption can be beneficial. But ultimately, what we're seeing now with more of like decades of data and pressure testing that is that it's really not. Even moderate alcohol use can be detrimental to the body from an overall mortality, all cause mortality space. Again, there's no like quote safe limits of alcohol. And I'm not anti-alcohol. I'll just say that. Like I've been known myself to enjoy from time to time. It's just understand. I believe it's all about trade-offs. Understand what it does to the body so that you can then figure out how to sort of account for the reactions that it may have in your body. But it's really just alcohol doesn't serve a purpose for your body and it prioritizes getting it out. So you're more likely to end up having like you should be eating while you're consuming, but if you're consuming at a level that the body can't process and get it out fast enough, and you're also having more food, we'll say maybe non-healthful foods at levels that your body can't really process either, you're just going to store a lot of that as adipose tissue, as fat, because your body can only process like 60 grams of glucose per hour. So if you're having more than the body needs of anything, it's going to
Mhm.
store it with the exception of alcohol because it prioritizes it out and it'll just more alcohol just causes it to store more.
Okay. Thank you for sharing that. And I think that also leads to like beer belly for, I think mostly affects men
Hmm. Yeah.
because they're storing a lot of adipose tissue in their tummy, I guess. So the next question I have is around how we talked earlier about how women can adjust their diets based on where they are in their cycle. So I wanted to ask you, like, what are your thoughts on women also adjusting their diet as they age? Is there research around this on how it should look
Mhm.
like? Women to be eating like less carbs, more protein at a certain age, or is it still early? Because I mean, women's health research is still pretty shaky. It's new, kinda.
That's right. Yeah, I think I would like to see more research that looks at our cycles along with our age and our nutrition. We just haven't there's not enough that layers them on in that way over time. There are probably some retrospectives looking at some of like the in the US the NHANES, the nutritional like big population based research studies that come out. I think Many countries have something similar, and then we are able to slice and dice the data later to see what it tells us. Um, I don't think there have been enough yet to definitively say we should make these pivots. But I can say that we know mechanistically, for instance, in that with the loss of estrogen, we know that cardiovascular disease increases, right? Because estrogen is cardioprotective. And so if we know that cardiovascular disease increases, so does metabolic imbalance, and things like insulin resistance and diabetes and atherosclerosis. And so we should be mindful of having or not having the foods that tend to promote cardiovascular disease or that tend to promote cholesterol plaque buildup in the arteries, or that tend to promote insulin resistance. So that might look like an anti-inflammatory eating pattern. It might look like having, lots of antioxidants and colorful vegetables and whole grains and lean proteins and staying away from really saturated fatty foods and foods with trans fats, which tend to be the fried foods, the refined carbohydrates, things that have a tremendous amount of salt and saturated fat and sugar. They're the trifecta of things that really swing the body out of balance. And they're the things that tend to taste really, I guess I will say, they're the comfort foods, right? They're the ones that a lot of people associate with comfort foods. And when we have PMS symptoms or menopause symptoms, they're the ones that tend to be that we reach for. And those are the ones that can end up not being beneficial to us. And as we age, especially, our brain takes a higher priority. Women have a higher risk of developing dementia and Alzheimer's. And so cognition and cognitive health should be a priority for us. And the brain has all of these little, micro arteries and things that really it can be highly affected by things like inflammation and insulin resistance, which you think that that's like more of like, oh, that's like a gut or a pancreas thing, but really it's a brain thing too. And so we need to be thinking about how to feed our brains as we age.
So many things to consider.
Yeah, it can be overwhelming. It's not that bad. It's why variety, a well-rounded diet of like lots of colorful veggies and fruit, lean protein, whole grain, healthy fats. If you can, fiber rich, those are pretty much fiber rich, colorful fiber,
Not just chia seeds.
not just chia seeds. There's a world of fiber out there for you. A world. Explore it.
I think it's like chia seeds, cottage cheese, Greek yogurt. What's the other thing that protein powder? And just, yes.
Yeah, and all of those things are great. They are good. Chia seeds are wonderful. They have a lot of really beneficial things about them. But again, variety, the body loves variety. If you only had this single same salad every single day for the rest of your life, your gut is going to be missing out on diversity. That's very important to it. Yeah.
Yeah. Thank you so much for clarifying that. And we are headed towards the end of the podcast. It's been awesome. I've learned a lot. Thank you so much. So, okay, let me pick a final one of many final questions. Okay, so for a woman who's listening to this podcast, what's one shift that she can make? We've talked about a lot of stuff in the past couple of minutes. So, what's one thing that she can do today that would help with her nutrition that supports her health?
So I'm actually going to give you two, just based on depending on where the listener is. Adding fiber. I do think fiber is incredibly important. You don't need to aim for 100 grams of fiber. That is aim for 30 grams. If you can get 30 grams of fiber from a variety of sources in a day, you will be great. Maybe your body personally needs more than that, but just aiming for 30 is a good place to be. And then the second thing is sleep. And I'm not going to tell you that you need to get more sleep. We all know we need to be getting like 7 hours of sleep. What I'm going to say is that if you only get to have 4 hours of sleep, that's all your life accommodates for you. Make that the best 4 hours that you can get in a night. I would rather have somebody get 6 amazingly solid quality hours of sleep than to lay in bed and toss and turn for 8 hours on. So sleep is so important. It's how we recover. It's how we consolidate memories. There are like so much is tied to increased risk of so many different conditions and diseases through poor sleep and lack of sleep. So if quantity isn't available to you, as with anything, I think quality is more important. The quality of foods that we're having, the quality of sleep that you're getting. Just make the hours that you can get the best you possibly can.
Okay. Thank you so much for sharing those tips, and I won't forget them either. And now to my favorite question in the entire podcast, and I think I need to vary this question at some point because I basically ask everyone now. So, what would you tell 15-year-old Helena?
Not to sweat the small stuff. 15-year-old Helena was really intent on being a perfectionist about a lot of things. I would say that 40, almost 45-year-old me, I would call myself a recovering perfectionist, and it still comes for sure. I don't think that really ever goes away when it's just part of who you are. Thanks to my parents, I love them dearly, but they're both perfectionists and I got it in spades. So I would tell 15-year-old me that it's okay to not have everything figured out
Mm.
and not sweat the small stuff. And that part of some of the most exciting pieces of life is going to come through the exploration of not having it all figured out.
And now for the final question. So, for people who want to learn more about you, the work you do, your podcast, anything else, where can they find the details?
Thank you. Well, if you're interested in just learning about me as a practitioner, you can go to Dr. Fowler DCN. DRF as in Frank OWLER DCN.com. And if you're a founder and you need some assistance, you can go to mindthegapservices.com. And you can find me on Instagram at Dr. Fowler DCN, and you can get to my podcast from there, or if you're on Instagram, you can go to Walk Into a Podcast. Lots of
Awesome.
ways.
I will include the links to everything in the show notes and in the description of the videos. And also the list that you mentioned earlier, everything will be there so people can find you and all the awesome work that you're doing. Thank you so much for being on the podcast. It's been awesome speaking with you.
Thank you. I really appreciate it. I've had a wonderful discussion with you.
Hi again. Thank you so much for listening to this episode of Blush and Bloom. I'm so glad you joined me for this conversation. If you found it helpful, please share this episode with a friend or someone who might need it. Let's keep talking about women's health and working towards better outcomes for all of us. You can find more episodes and resources at www.asale.tech and check out our app at www.asale.health. And you can follow us for more updates on Instagram at asale.tech. Until next time, I'll see you in the next episode. Take care and bye-bye.